When health workers in England started dying from COVID-19, this seemed to be disproportionately from the black, Asian and minority ethnic backgrounds. Then the politicians started to ask questions about it. But now the Public Health England review itself has confirmed that people from black, Asian and minority ethnic backgrounds are at a greater risk of dying from COVID-19.
This work underlines that being black or from a minority ethnic background is a major risk factor. This racial disparity holds even after accounting for the effect of age, deprivation, region and sex.
Citing the Public Health England report, the British Health Minister says that people of Bangladesh ethnicity have around twice the risk of death than those from the white British ethnicity. Other Asian and black ethnicities show a 10 to 50% greater risk of contracting this disease and dying from it. The government had already launched an inquiry in April into what's going on in England, and as per the review, which raised concerns about the reporting of the data. But what data do we actually have on this? Now, the latest NHS review shows that 18% of those who died at hospitals after testing positive for COVID-19 were from ethnic backgrounds. That compares to the census in 2011, which shows 14% of the people were from the same black, Asian and ethnic minorities. But there appears to be a starker difference in intensive care. The data shows that 1/3 of those in intensive care with COVID-19 were from ethnic minorities. And the report adds that age remains the biggest risk factor and being male is another. These reports and their findings are released as the United States faces widespread protests against social inequalities triggered by the death of a black man in police custody in Minneapolis. Hancock echoed the sentiments of protesters in the UK Parliament by quoting Black Lives Matter and saying that the government wants to improve health outcomes for people across the UK.
Black Lives Matter, and as do those of the poorest areas of our country, which have worse health outcomes, and we need to make sure that all of these considerations are taken into account and action is taken to level up the health outcomes of people across this country.
Anyone tracing the faces of the workers who have lost their lives to coronavirus will be struck by how many appear to be from ethnic minorities. However, studies from around the world are still looking to see at the specific risks of severe COVID illnesses in certain communities.